Good morning. My name is Paul Palumbo. I'm an infectious disease trained pediatrician here at Dartmouth-Hitchcock and the Children's Hospital. I've been here for about 15 to 16 years, and before that I've practiced for a few decades in New York and New Jersey. This is a very exciting time, and this morning I'm going to discuss, and I hope to take questions, the recent developments in the COVID-19 vaccine universe. A very exciting week, auspicious. Many things have happened. Most of you, or many of you in the audience, probably have been following this closely in the news. At the beginning of the week, the FDA convened their advisory panel for immunizations, and they went over the data from the COVID-19 Pfizer vaccine that was developed in a trial targeting adolescents from age 12 to 15 years. So an attempt to bring the vaccine to the public in this age group. The advisory committee was very impressed with the data. It seemed very safe and efficacious, and they recommended approval, which the FDA quickly did. That was the first step in the approval of the COVID-19 vaccine generated by Pfizer. The second step occurred yesterday, and this is a CDC-based step. They also have a blue ribbon advisory panel made up of experts in the field who also reviewed the Pfizer data and came to the same conclusion, that it was safe, effective, and important to approve and bring to the public. So we've got all the approvals necessary in a system which is very rigorous to go forward with immunization of adolescents in the 12 to 15-year-old age group. The study that was done to support this was conducted in about 2,200 youth aged 12 to 15 from across the country. Many sites participated in this study, and they generated the data. The study was designed as a bridging study. It's much smaller, as you probably can appreciate, than the big adult studies which were done initially. But this is a typical path for vaccine development. That is, very large studies in adults, followed by smaller but rigorous studies in descending age groups. So right now we have the data for 12 to 15 years. In the field are studies now for children between 5 and 12 years of age. So we'll be going through this same process probably later this summer for that age group. Among the 2,200 individuals who participated in the 12 to 15-year-old study, they were divided into two groups. Half of them received placebo, which was a salt water placebo, and half of them received the true vaccine. Among those who received the true vaccine, in the short period of follow-up, there were no infections with COVID. Among those who received placebo, depending on how you counted, there were between 16 and 18 infections with COVID-19. So a fairly dramatic difference in infection rate depending on whether one received placebo or the vaccine, largely and highly in favor of the vaccine. In addition, careful studies were done as far as how the youth responded regarding their immune system. Did they respond vigorously to the vaccine, and compared it to the adults and older adolescents who had been previously studied. And not surprisingly, they responded, the 12 to 15-year-olds responded very vigorously and robustly. And in fact, when it was looked at closely, they responded a little bit better than the 16 to 25-year-old age group. And again, this is very typical of vaccine development and response to immunization. The younger you are, the better you seem to respond. So age is important here. The other important piece, besides immune response and besides infection rate, is safety. And we're all very concerned as to whether these vaccines are going to be safe, especially as we get into younger age groups. Remember that this Pfizer vaccine has been used extensively in this country. There have been tens to 100 million doses administered in this country across a variety of age groups from 16 to the very elderly. And the safety signals have been very promising amongst this large use experience. Also, about 1.5 million youth aged 16 to 17 have been given this vaccine. So they're very close in age to the 12 to 15-year-old age group that we're focused on this morning. And they have done very well with this vaccine also. So there's a lot of good feeling about this vaccine in the professional community, and we're trying to share that with the community at large to try and encourage the use of this vaccine in 12 to 15-year-olds. So as of this morning, in Vermont and New Hampshire and elsewhere around the country, vaccine availability for 12 to 15-year-olds is now open. You can make appointments through the usual channels for older individuals, but you can make appointments for 12 to 15-year-olds right now. In both Vermont and New Hampshire, there is a requirement for parental or guardian consent in this age group. So there will need to be consent for administering the vaccine in 12 to 15-year-olds. This can be done ahead of time online when you make the appointment. It can be done electronically through an iPad or a computer, or it can be done in person the day of the immunization. But do be aware that there needs to be an approval or consent on the part of a guardian or parent. So that's all in the works. The advisory panels, we're very excited about this. I can also share with you that the American Academy of Pediatrics, the premier group of practicing pediatricians in this country, have come out strongly in favor of employing this vaccine in 12 to 15-year-olds. So we have broad support and broad consensus in the medical professional community for this. I am aware that there is a fair amount of vaccine hesitancy out there in the community, both among adults who are able to consent for themselves, and now there probably will be, almost certainly, some vaccine hesitancy amongst parents or guardians of 12 to 15-year-olds. This is understandable. There's a lot one can find on the internet, some pro, some con. Some of it is very emotional and strongly worded, and it's hard to sort through all of this information and come to a decision about your own child or your own adolescence, which is obviously a very important decision to have to make. I would encourage anyone who still has hesitancy about the vaccine and its safety and the appropriateness of using it in 12 to 15-year-olds to consider talking to your own healthcare providers, whether it's one that provides healthcare for you or healthcare for your adolescent. The vaccine, as I mentioned, is available through general channels. It's likely to become available in medical offices of pediatricians and family providers. This is in the works and will sort out and develop over time. But the usual channels that the vaccine has been available through for the last months can be now accessed by 12 to 15-year-olds. So that's all very good. There's also talk about the possibility of schools being able to offer the vaccine. And this is going to vary from municipality and locale to locale. So stay tuned on this. I think, though, the strongest link for information beyond what we talk about today is going to be your own pediatricians and family practice providers who are pretty well versed in what's been going on. So, how does this vaccine work? It's a pretty new vaccine. It's what we call an mRNA vaccine, messenger RNA vaccine. The virus is a pretty small little life form. and it has something called spikes on it. And if you look at the picture over here, you can see a picture of the coronavirus, and these little spikes coming out are what the virus uses to attach to a cell in the human body and then enter the cell and do its thing. The vaccine that is used by Pfizer and also by Moderna takes the gene from the virus that codes for this protein, the spike protein, changes it a little bit, and then packages it in lipids or kind of like an oil, but it's a small package that can then be delivered through an injection, and it will find host cells, cells in your body, enter the cells, and then that gene, that mRNA gene that codes for the spike protein, is uncoded, and it's used by the cell to make the spike protein. That spike protein is then seen by our immune system. It's seen as foreign, as something that should be dealt with, and we develop an immune response to that spike protein. So this is how it works. As I mentioned, it's a relatively new approach, but it has been used extensively already in infections like Zika. It's being developed for flu, and there's been 3 or 4 other infectious diseases that vaccines have been created for using the mRNA technology. So it's pretty safe. The other neat thing about this technology is it allows us to make a vaccine quickly. You saw how quickly, we're about 14 months into lockdown or semi-lockdown. So last March of 2020 was when this hit us pretty hard. I don't think any of us imagined that we'd be where we are today, still dealing with the coronavirus. But also, quite strikingly, we have a handful of vaccines, including these mRNA vaccines, which have proven to be safe and which have been proven to be quite efficacious. So that has been a very dramatic development of medical technology and medical know-how. So we have these vaccines. The mRNA vaccines can be adjusted to address variants or mutants that may come along, and we've all heard that there are a few mutants emerging from different parts of the world. These mutants may be a little bit more infectious, but fortunately our current vaccines seem to be effective against not only the original coronavirus, but the new mutants that are coming along. And as you might imagine, scientists are carefully watching these mutants and matching them against the vaccines we have to be sure they continue to be effective. There are already plans in the works to make additional vaccines or to tweak the vaccines to address mutants as they come along. So that's very positive, I would say. So what about dosing? We're getting into younger age groups, the 12 to 15-year-old age group. In the trial, the dose used for those individuals is the same that's used for adults. It's a 2-dose vaccine, as many of you know who've received this vaccine, and it's recommended that 3 weeks separate the first dose and the second dose. And that's exactly what was done in the 12 to 15-year-olds, and it's what is recommended. As we get into even younger age groups, the 5 to 12-year-olds and even under 5-year-olds, the trials in the field are studying 2 doses, a reduced dose and then the same dose as the adults. And we'll see how that plays out with time. But at least down to age 12, it seems very safe and effective to use the adult dose in this 12 to 15-year-old age group. So that's the plan. That's what's been studied. That's what we'll see going forward. Okay, one question is that comes up frequently is that we've heard, and I can share with you, that children tend to get COVID less frequently than adults, and when they do get it, it tends to be mild. So why would we want to use a vaccine for something that's fairly mild and not as common as the adults? And I'll give you a few reasons to consider. One is that youth still get infected. As the vaccine rollout has occurred and the older age groups have been vaccinated, we're seeing much fewer infections in older age groups. We're seeing much less hospitalization in older age groups. Today, what we're seeing, if you look at hospitalizations, the percent of hospitalizations that are represented by the under 20-year age group is increasing, and the number of infections among those who are less than 20 is increasing as a percent of the population. So we are seeing infection in youth, especially problematic in the 10 to 20-year age group. So it brackets this 12 to 15 group that we're talking about today. So it is still a problem, and it's true that most youth and children who get COVID handle it very well. But there is a small subset that can get severe illness, especially if they have underlying conditions. The underlying conditions are things like obesity or immunocompromise from cancer, for instance. Asthma is a real problem. And there's a list of other underlying conditions in youth which can contribute to making their infection more severe than average. We have another phenomenon that has been recognized now for about 9 or 10 months. Excuse me. And that's something called MIS-C. That's multi-inflammatory syndrome of children. This doesn't occur usually during the beginning of an infection. It usually occurs after the infection pretty much resolves, and then a small number of individuals, maybe a week or two out, come back with fairly dramatic multi-system complaints and issues. Very severe illness at times. Many of them needing to be in an intensive care unit. They may need to get help breathing. They may need help to support their blood pressure. So it's a very severe phenomenon that it can occur late in a COVID infection. We certainly want to try and prevent that from occurring and keep the numbers of individuals who experience that as low as possible. Most children survive this and recover completely, but some children will have long-term after effects. We've all heard of long COVID among adults. Something similar can occur in a very small but significant number of children and adolescents. Some of it can be long-term heart problems, which can persist for, right now we have experience with months, but we don't know how long into life that will continue to be problematic for these individuals. So there's good reasons, I believe, to immunize youth, 12 to 15-year-olds in our case today. There's good reason to immunize them for their own health. Then if we look at the general community, there's also good reason to immunize youth. They can be a source of bringing infection to others. For instance, a grandparent would be bad. Many of us have worried about interacting with our grandparents during this pandemic. A lot of us, upwards of half of the U.S. adult population has been immunized at this point, and certainly there's been a concerted effort to immunize the elderly, those in assisted living facilities or who are living alone at home but are elderly. So that has gone reasonably well, but there are still elderly individuals who are susceptible, and it would be nice not to be bringing infection to them. And the children and youth in our families can participate in that process if they're not immunized and immune to COVID. There's also schools. There's also sports. There's many group activities that we'd like our children and youth to participate in without fear, or at least dramatically lower risk of either getting COVID themselves or spreading COVID. We've had problems in the Vermont, New Hampshire area with hockey teams. There was, early on in the pandemic, there were outbreaks in a large number of hockey teams, which created havoc there. You can imagine the same being true for other sports and group activities, classroom activities. There is summer camp coming up. So there's a lot of really good reasons, both for personal protection and for group protection, to engage in immunization. And we now have the opportunity to offer it to 12 to 15-year-olds. So I hope you can sense my enthusiasm for this, and I hope I can transmit some of that enthusiasm to the audience. Again, there will be people who remain somewhat hesitant, understandably, and I, again, would restate the encouragement to talk with professionals that you interact with in the healthcare community to come to the best decision that you can. But there's a groundswell of support now among professional organizations and advisory committees, et cetera, that really provide what I think is great reassurance to move down this path aggressively. So there are some questions that have come along. Are there any medical conditions which would make you worry about taking this vaccine? And I would say the answer is no, other than if you have sensitivity or previous reactivity to a vaccine like this or any of its components. That's the main contraindication. And it's hard to imagine many people are going to qualify for that contraindication. So in general, healthy individuals or individuals with underlying conditions should be prioritized for this vaccine. What about if a youth, 12 to 15, had COVID? And there's certainly a number who have in our middle schools and high schools. Past COVID is not a reason to not get this vaccine. Past COVID, an individual will have developed an immune response to the virus, but that immune response wears away with time. And so it's important to also vaccinate individuals who've had COVID in the past. What about someone who has COVID now? Well, there we'd want to wait until COVID resolved and they get out of the quarantine period, whatever that is for your area, usually a week or so. Then they're eligible at that point and encouraged to get the vaccine. What other questions do we have here? We talked about dose. What about side effects? Is it any different in our 12 to 15-year-old age group compared to what we know from the broad experience, the 100 million doses that have been given? And not surprisingly, there's no difference in side effects or reactions in this 12 to 15-year-old age group compared to older children and adults. What are the side effects? A lot of people get pain in the arm after the injection for a day or two. Some will get flu-like symptoms. That includes fever, muscle aches and pains, maybe feeling a little bit tired, maybe some achy joints. This traditionally and generally lasts for 1 to 2 days. Some Tylenol is really all that's recommended in these situations. And essentially everybody gets through this after a day or two. There's usually a little more pain after the second dose, but in general, these are the side effects. Some individuals have nothing. Some have a period of time when they can't go to work or school. It's usually a day or two, and then they get back into general activity. So the side effect profile and the reactions that the 12 to 15-year-old age group experienced were essentially identical to what we know has already been occurring in older people. So nothing worrisome there. Don't know if there are any other questions out there, but I think I've gone through a lot of the points that I wanted to go through. Do we know if there's any other questions? Okay. So, I personally am very excited by the opportunity to offer this to 12 to 15-year-olds, and I'm also very excited about the almost certain upcoming opportunity to go lower in age. 5 to 12 years would probably be our next, and the prediction is by late summer. The results from the studies that are being conducted right now will be available, will be carefully reviewed as they were for this 12 to 15-year-old age group, and hopefully be available for children who are in grammar school and middle school, the 5 to 12-year age group. And ultimately, the scientists are looking at below 5 years of age also. In addition to Pfizer, which is the vaccine that seems to be in the front wave here and is available now, the Moderna vaccine, which is a similar vaccine, that company is studying youth and younger children also. And I believe some of the other vaccines that aren't in wide circulation yet in the US are also being looked at for pediatrics. So this process of vaccine development is very typical. Whether it's a vaccine or a drug, there's a sequential process of developing it in adults, large studies, and then bridging to smaller but rigorous studies in adolescents and children. So it's a well-traveled path where we have a lot of experience and when there's a lot of oversight. In addition, there's continued oversight after approval of a vaccine. So for instance, this 12 to 15-year age group, there's probably going to be, and hopefully going to be, a large number of 12 to 15-year-olds which gets this vaccine. There is careful attention to any side effects that may occur post-approval. This data is carefully collected, analyzed. As you saw with the Johnson & Johnson vaccine, there was a red flag that popped up in a very, very small number of individuals. The administration of the vaccine was halted until all of the data could be reviewed carefully and thoughtfully, and then it reopened again. So it's a very careful process. This will occur with the Pfizer vaccine as it goes into younger age groups and younger arms. So there will be ongoing careful evaluation for any possible problems. But it really looks extraordinarily promising. This is, to date, the coronavirus vaccine effort, and Pfizer is certainly a prime example. It's one of the best vaccines we actually have. It's quite safe, it's very effective, and it will hopefully allow all of us to get back to what we consider a more normal social lifestyle that we were used to before coronavirus. Okay. Okay, there's a question that came in. I'll read it. What if my child has told me they don't want to get the vaccine? How can I talk to them about it? You can share some of the information that we discussed today. You can also have them or offer for them to talk directly with their physician, with their nurse, for information and for consultation, if you will. It's always hard if a child has set their mind or if they play in a group that the consensus of the group is that these vaccines are bad and they don't want to take them. So that is an important piece of the process. I mentioned at the outset that consent from adult parents or guardians is required in Vermont and New Hampshire. There's a similar piece to this, and that is assent by the minor child, the 12 to 15-year-old. So it is important and essentially necessary to have the assent of the 12 to 15-year-old. So I would talk to them carefully. I would try to reassure them that it's safe. I would point out that it's very effective and could help prevent them from transmitting to someone else if they do get infected. And it could prevent them from, or very much lower the risk of the severe outcomes that occur in a very small number. So I'd make those points and maybe refer them to your pediatrician or your family practitioner to discuss further. So those are some options that you have. Another question, which vaccine is better for the 12 to 15 age range, or is there only one? There's only one at the moment, and that's the Pfizer vaccine. This question of which is the best vaccine or the better vaccine has played out already, obviously, among adults. We've had the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. J&J was very appealing because it's a single dose. You don't need to come back for a second immunization. The other two are appealing because they came out sooner, and there was a stampede among those who wanted the vaccine to get the vaccine as soon as possible. So there's really no read on which one is best. To date, the advice has been to get the vaccine that you have access to. Right now we have access to the Pfizer. It's very good, it's very safe, so I would really encourage trying to get this vaccine. In a few months, we may have options for the 12 to 15-year-old age group. Moderna may come along and be available. So that's what is on track for the foreseeable future, are those two vaccines. So I see no reason not to just go for the Pfizer at the moment. And if you're still out there unimmunized in this age group, when Moderna comes along, that's probably going to be very fine also. Okay. So I hope I have shared my enthusiasm for this vaccine, my excitement about the availability of a vaccine to target 12 to 15-year-olds. I know there's some movement this morning already to immunize this group. The folks who have been waiting for this anxiously are going to move quickly. There's going to be a number of other individuals who may decide to wait and see what happens. Personally, I think doing it sooner rather than later, getting the vaccine sooner rather than later, is the way to go, and will be more immediately protective and will accelerate not only the social interactivity of the 12 to 15-year-old, but also bring society as a whole closer to a period of time when we can open things up and be socially interactive as we were before the pandemic. So I really thank you very much for your time. Please feel free to reach out to your local healthcare providers, to us here at DH for further questions or issues. And we look forward to working with individuals and the community in getting this coronavirus pandemic under control. So thank you very much and have a good day.